Okay, everybody, we're going to cover the subject of eating disorders on this video. I don't know that you can really call eating disorders an addiction, but there's certainly a compulsive component to it all, and it's very hard to recover from. It takes a great deal of work. So I like to include it for those reasons, but also because you're going to find that many of your clients, if you go into the substance abuse field, have co-occurring disorders. It could be some kind of mental illness issue, like depression or anxiety, but it could also be eating disorders, or at least maybe a past of eating disorders. So let's take a little bit of a look here. I won't just sit here and read those slides for you. I'll do a little bit of reading, but I hope to toss in a little bit just to further your understanding. So there's actually quite a few factors that influence eating disorders, and it depends on which type of eating disorder that we happen to be talking about. So part of doing treatment with eating disorders, of course, is a pretty extensive biopsychosocial, so we can get a look at the background of this individual. So this makes the point that it's not simply about the eating, it's about the control, right? And again, depending on the kind of eating disorder, it's controlled in different ways, and it may be a compensation for certain kinds of feelings or emotions, or a way to express feelings and emotion. Plus, people also hear about these kinds of eating disorders and turn to it sometimes as a way of helping them cope with issues in their life. So just a quick rundown of the various disorders. We're not going to spend a lot of time on the bottom ones, but I do want to hit certainly the first 3, 4, maybe 5. But believe me, there are other types too. So I should say before we go any further that this information is based on the DSM-5. DSM stands for Diagnostic and Statistical Manual for Mental Disorders, and it's probably the most commonly used way of diagnosing people. So let's start with anorexia. Whoops, I just want to make sure you can see it. And talk a little bit about some of the symptoms of anorexia. I think most people are probably familiar with anorexia and what it's about, and it's about, restricting your eating in a very, very severe way. And accompanying that is a really distorted view of what your body looks like. If you've ever seen any talk shows or videos of people with anorexia, they have a very unrealistic idea about how much they weigh or what they happen to look like. So it's characterized by things like a fear of gaining weight and a preoccupation with food, and low self-esteem. Now, it's very possible that anorexics are also quite ready achievers, the kind of kid who's a perfectionist, wants to get the best grades possible, and to be the best son or daughter possible. It's more common with women than men. With anorexia, and we're going to look at a couple of the physical symptoms of anorexia, you will see significant depression in most people, which makes a certain amount of sense because you're such low energy at that point. And so taking a look at some of the symptoms, changes in clothing style, I always, during the summertime, every once in a while, I've seen somebody in these heavy sweats really bone thin. And part of that's because with anorexia, you do happen to get cold. You don't always have the body fat that you need. So it might be, baggy clothing to hide their looks and that kind of thing. Obsessive rituals around food, which just means things like cutting all of your food into cubes or squares, so you can control just how many of each you happen to be eating. People like this also, find excuses to avoid meals. You'll find it kind of an obsessive thing about weighing themselves. In a couple treatment centers that I visited that dealt with eating disorders, they would weigh the patients every so often, but they always had them facing away from the scale so that they couldn't really see on it, because we know about that kind of obsession about weight and how freaked out people can get at gaining a pound or two, that social kind of thing. Suicidal or self-harm thoughts and repetitive dying, restrictive eating, rigid eating patterns, and so on. This is a very dangerous disorder. People die from this disorder. In the old days, part of the diagnosis had to do with losing 15% of your body weight. I haven't seen that yet in the new manual. But you understand, at some point as you start to constantly lose potassium, electrolytes, and that kind of thing, very, very hard on your heart. And people do die as a result of that. You can look at this on your own at your leisure, but I just found a very nice little handout from the Victoria Treatment Center that lists, the different parts of the body and how they're affected by anorexia. So take a look at that. That could be important for tests. The other disorder, the second one, is bulimia, and I think most people too are familiar with at least the name of bulimia nervosa. And bulimia is simply taking in large amounts of food and calories in a very short period of time. So to get more specific in diagnosing, we're talking about binge episodes associated with a sense of loss of control and feelings of guilt and shame because of the amount of food that people have taken in. So one way that people try to exercise control over the calories they just ingested would be things like self-induced vomiting, fasting, over-exercise, misuse of laxatives, enemas, and so on and so forth. I have seen people come into treatment before that were taking like 20, 25 laxatives at a time, if you can just imagine. But your body gets resistant to it after a while, and that's why the increased use in laxatives. Now, but bulimics, the funny thing about bulimics is that they're not going to necessarily be excessively heavy or excessively thin. Many bulimics look to be about of average weight, a little above or below. And they're, bulimics are different from anorexics in that you'll see a lot of attempts to try and control this, and early attempts at other things as well. So for instance, whereas anorexics are kind of antisocial, you find that bulimics tend to be more social, and they may be drinking heavily at times. It might be early experimentation with sex and that sort of thing, but definitely more social than anorexics, who don't always go out too much. So You definitely see mood swings and personality changes and all of that. Sometimes attempts at self-harm, self-disgust, self-loathing, that sort of thing. And the way I've picked up on a couple of bulimics myself is, we're eating, maybe just sitting around watching a game or something, and suddenly they disappear, which is mostly about purging, and that's an issue in treatment centers. About, contracts to stay with everybody else, for a certain period of time after eating so that they don't disappear and purge. Really purging doesn't get rid of that much food. As a rule, maybe about 25% is what I've read in the past, but I imagine that it could be more than that, but it doesn't really get rid of absolutely everything. So with bulimia, as I was mentioning, trips to the bathroom after eating, depression, certainly, fluctuations in weight and erratic behavior. Let me see if the next slide gives a couple other things. With bulimia, sometimes people are characterized by what we call chipmunk cheeks. Their cheeks start to swell and get puffy from the purging. And dentists, many dentists can pick up on bulimia because of the condition of people's teeth, with the stomach acid and everything constantly being washed over. And most dentists these days, I think, are pretty up on the issue and can identify it. So again, another handout about the various parts of the body and the effect on that. Look at that as you have time.